So now we're going to discuss the third nerve, oculomotor nerve. So oculomotor nerve, now first thing you have to know what are the functional columns present in the oculomotor nerve. Okay, so the functional columns, the oculomotor nerve supplies extraocular muscles. All the extraocular muscles are supplied by our oculomotor nerve except SO4 and LR6. So oculomotor nerve, the functional components. What are the functional components present in the oculomotor nerve? Number one, general somatic efferent, GSE column. Now GSE column means it is supplying the extraocular muscles. Okay, so GSE column, it is supplying the extraocular muscles. Extraocular muscles. Okay, right. Number two, this oculomotor nerve not only supplying the extraocular muscles, it is also supplying two more muscles, smooth muscles. One is ciliaris, another one sphincter pupillae. Now these two muscles, they get the nerve supply from Edinger-Westphal nucleus. The third nerve carry the fiber via ciliary ganglia. Just now I told you the ciliary ganglion discussion. Okay, so they also carry general visceral efferent fiber. So parasympathetic column supplying two muscles. What are those? Ciliaris and sphincter pupillae muscle. Right. Okay. So now we have a nucleus, separate nucleus for these two functions. Now GSE column, the nucleus is motor nucleus of oculomotor nerve. Now we have separate nucleus for this. That is motor nucleus of oculomotor nerve. Motor nucleus of oculomotor nerve. That is the midbrain. And GVA column is supplying two muscles, ciliaris and sphincter pupillae muscle. The nucleus is Edinger-Westphal nucleus. Very good. Just now I told you, ciliary ganglion, no? Edinger-Westphal nucleus. Edinger-Westphal nucleus. Okay, right. So now we're going to trace the course of the oculomotor nerve and then we see the diagram. Okay, right. Now, yes, this is the motor nucleus of the oculomotor nerve. Fine. So now from here, the third nerve will carry the fiber. Now, oculomotor nerve, it is present in midbrain at the level of superior colliculus. So oculomotor nucleus is present in midbrain at the level of superior colliculus. Present in midbrain at the level of superior colliculus. Now this is the motor nucleus. Motor nucleus of third nerve. Okay. Now the nerve is exit. The nerve comes out, passing out between the two arteries. What are those? Posterior cerebral artery, very good. Posterior cerebral artery and superior cerebellar artery. So nerve is coming out, passing between these two arteries, posterior cerebral artery and the superior cerebellar artery. Now between these two arteries, two nerves will come out. I told you in the brain topic itself, in the blood supply of brain topic. Two nerves. What are those? Third nerve and fourth nerve, they are passing between posterior cerebral artery and the superior cerebellar artery. Okay. Now after passing between these arteries, then the oculomotor nerve is entering the cavernous sinus. Now in the cavernous sinus, the oculomotor nerve is passing through which wall? In the lateral wall or through the sinus? In the lateral wall. So now this is our cavernous sinus and the nerve is passing in the lateral wall of the sinus. This is a cavernous sinus. Okay, so the oculomotor nerve, it is passing in the lateral wall. I am writing LW. LW means lateral wall. After coming out of the cavernous sinus, then the nerve is divided into the oculomotor nerve dividing into superior division and inferior division. Now the superior division and the inferior division entering the orbit via supraorbital fissure. Now in the supraorbital fissure, it is passing through common tendinous ring. So now this is the supraorbital fissure. Now supraorbital fissure, it is divided into three compartments by our common tendinous ring. That is our common tendinous ring. Okay. And here, yes, this is superior division of oculomotor nerve and inferior division of oculomotor nerve. They're entering the orbit by a superior orbital fissure. This is superior orbital fissure. Now, superior orbital fissure, it is passing through common tendinous ring. And the superior division of oculomotor nerve supplies two muscles. What are those? LPS muscle, levator, palpebrae superioris muscle, and it also supplies one more muscle, superior rectus muscle. So two muscles supplied by the superior division, superior rectus muscle. Okay. Now the inferior division, which in turn gives a branch to three more muscles. What are those? It is giving a branch to inferior rectus, medial rectus, and also to inferior oblique. These are the five muscles supplied by our oculomotor nerve. Now we have some special feature for the muscle LPS and superior rectus muscle. Now LPS muscle is supplied by the single undivided nucleus. It is supplied by the LPS muscle is supplied by single undivided nucleus. Supplied by single undivided nucleus. Single undivided nucleus, LPS muscle. Similarly, superior rectus is supplied by the contralateral nucleus. Contralateral nucleus. Okay, these 2 points are very important. So whenever you see the nuclear lesion, the patient will have bilateral ptosis. Why bilateral ptosis? Because LPS muscle, two sides, they are supplied by single undivided nucleus. So whenever there is a nuclear lesion, then patient will have ptosis on both sides. Bilateral ptosis will be there, and the contralateral palsy of superior rectus muscle. Okay. So please write one small box, and then write, whenever you see nuclear lesion for the third nerve, patient have bilateral ptosis, and opposite side contralateral superior rectus palsy. Is that clear? Right. Now come to the diagram. Now next one, your Edinger-Westphal nucleus. We're going to trace the Edinger-Westphal nucleus. Now Edinger-Westphal nucleus fibers, yes, this is Edinger-Westphal nucleus fiber. It is a parasympathetic fiber. Okay, that is carrying general visceral efferent fiber. Now from here, yes, the oculomotor nerve, the fibers are carried by oculomotor nerve, and then to the inferior division of oculomotor nerve, and then the fibers are passing along the nerve to inferior oblique. Now here the fibers are relayed into ganglion. Which ganglion? Ciliary ganglion. The ciliary ganglion, the fibers are relayed. So from here, which in turn supplies two muscles. One is ciliaris, another one sphincter pupillae muscle. Now this is our ganglion. What ganglion? Ciliary ganglion. Now this is our short ciliary nerve. So through short ciliary nerve, the fibers from ciliary ganglion supplies two muscles. What are those? Ciliaris muscle and sphincter pupillae muscle. Okay, right. Shall we proceed? Now what is the parasympathetic pathway for the third nerve? Now fibers from Edinger-Westphal nucleus, we're going to write the pathway. Fibers from Edinger-Westphal nucleus given to third nerve, the trunk of the third nerve. Now from the third nerve, the fibers are given to inferior division of third nerve. Now from there, the fibers are given to nerve to inferior oblique. Now from nerve to inferior oblique, fibers are given to ciliary ganglion, and via short ciliary nerve supplying two muscles, ciliaris and sphincter pupillae muscle. Okay, right. Now see the diagram. Now this is the pathway for the third nerve. Now this is the motor nucleus of the third nerve. Okay, fine. And fibers from here is exiting out between the posterior cerebellar and superior cerebellar artery, and then entering the cavernous sinus, passing in the lateral wall, and then enter the orbit via superior orbital fissure, dividing into superior division and the inferior division, and then supplies the muscles. Now this is the nerve to inferior oblique, this branch. yes, which in turn have a connection to ciliary ganglion. From there supplies two muscles, sphincter papillae muscle and ciliaris muscle. Okay, right. Now this is a diagram of the cavernous sinus showing the nerves in the lateral wall. So oculomotor nerve passing in the lateral wall. This is a cavernous sinus diagram passing in the lateral wall of the sinus. Okay. So one last point, the features of oculomotor nerve injury. Okay. So now oculomotor nerve injury, the features are P, PD, PDO. This P silent. So patient will have ptosis. I told you the oculomotor nerve supplies all the extraocular muscles except SO4 and LR6. So P means patient have ptosis. Yes, the drooping of eyelid. So patient have ptosis. PD, see the pupil. Pupils are dilated. Dilated pupils. Dilated pupils. Now why dilated pupil? Due to the palsy of sphincter papillae muscle. Due to the palsy of sphincter papillae muscle. Okay. PDO, P silent. The eyeball is down and out. Down and out eyeball. Eyeball is down and out. Okay. Down and out eyeball. Why? Only two muscles normal. Superior oblique and the lateral rectus. Now superior oblique muscle depress the eyeball and the lateral rectus muscle abduct the eyeball. So eyeball will be down and out. Plus loss of two reflex. Now ciliaris muscle I told you supplied by third nerve carrying the fibers from heading small nucleus via ciliary ganglion. So ciliaris muscle palsy also there. So because of that loss of accommodation reflex. A third nerve also involved in light reflex. So loss of accommodation reflex and the light reflex. Okay. Right. These are the points we have to know about the features of third nerve injury. Fine. And that's all about the third nerve. Next, we're going to discuss the fourth nerve. So now we're going to discuss about the trochlear nerve. See, trochlear nerve, yes, it is having only one functional column, that is having general somatic efferent, and it is applying only one muscle, superior oblique muscle. Superior oblique muscle. Now, before seeing the course of the trochlear nerve, we have to know certain important features of the trochlear nerve. See, trochlear nerve, it is the only nerve which emerges through dorsum side of the brainstem. So it is the only nerve with dorsal exit. And it is the smallest nerve. Smallest nerve means it is a slender nerve. It is a slender nerve, smallest nerve, having very few axons. Okay. Next, it is having the longest intracranial course. Longest intracranial course. Longest intracranial course. And it is the nerve which is decussate inside the brain. So no other nerve, cranial nerve, it is crossing inside the brain, but it is the only nerve which is crossing inside the brain. Decussate inside the brain, that is internal decussation you see. Internal decussation. Is that clear? So these are the basic points for the trochlear nerve. Now see this diagram. Now in this diagram, now this is our nucleus, trochlear nerve nucleus. Now trochlear nerve nucleus, it is seen in midbrain at the level of inferior colliculus. So fourth nerve, trochlear nerve nucleus, it is present in midbrain at the level of inferior colliculus. Inferior colliculus. Okay. And then after arising from the nucleus, see here, I told you, it is a only nerve which is crossing inside the brain. Now this is the right side say. This is left side say. We are assuming right side, left side. Okay. Don't ask me why right, why left. We are assuming this is right side and left side. Fine. Now this is the right side nerve. After crossing, it is coming to left side. So this nerve is called right trochlear nerve only. Okay. Now this is a nerve present on the left side. After crossing, I am saying nerve coming from the right side. It is crossing, and after crossing, it is coming to left side. So this nerve is called left trochlear nerve. Is that clear? Now why I have done right and left? We are not considering the decussation. That is the point I want you to remember. See, right side trochlear nerve, it is coming from left side nucleus only. Left side trochlear nerve, it is coming from right side nucleus only. It is crossing inside the brain. After crossing, it is coming to the opposite side, right side, left side. The point is, we won't consider this crossing. So when I say left side trochlear nerve supplies left side superior oblique muscle. When I say right side trochlear nerve, it is supplying right side superior oblique muscle. Is that clear? Don't get confused. Don't mind the decussation. Please consider the nerve only after decussation. The nerve present on the right side, right fourth nerve, supply right side superior oblique. The nerve present on the left side supplies left superior oblique. Is that clear? Am I clear? So please remember this point. So don't think too much. Don't make mistake. If they say left fourth nerve, that means the nerve after decussation only. Left fourth nerve supplies left superior oblique. Right fourth nerve supplies right superior oblique. First clear this point. Okay? Clear? Shall we proceed? Like the third nerve, the fourth nerve also passing between the two arteries. What are those? Posterior cerebral artery and superior cerebellar artery. Just now I told you. Posterior cerebral artery and superior cerebral artery. Between these two arteries, two nerves passing. What are those? Your third nerve and fourth nerve. And then enter the cavernous sinus. Now in the cavernous sinus, the trochlear nerve is passing in the lateral wall of the cavernous sinus. This green color is our cavernous sinus. Okay. Now it is passing in the lateral wall of the cavernous sinus. So from the cavernous sinus, it is entering the orbit via superior orbital fissure. The superior orbital fissure, we have three compartments. Okay, supralateral, intermediate and inframedial. Now in the supralateral part, we have a mnemonic. What is that? LFT. Intermediate, such as passing through common tendinous ring, Sonia, SONIA. So LFT, lacrimal nerve, frontal nerve, trochlear nerve, they are passing through supralateral part of superior orbital fissure. Supralateral part of superior orbital fissure. And then supplies which muscle? Only one muscle, superior oblique muscle. This is the course of the trochlear nerve. Okay. Right. Now shall we do one quick revision? Right. Trochlear nerve, after crossing inside the brain, it is passing between the two arteries. What are those? Posterior cerebral artery and superior cerebellar artery. Fine. The nerve enters the cavernous sinus. Passing in which wall of cavernous sinus? Lateral wall. Very good. Now from the cavernous sinus, the trochlear nerve enters the orbit via supraorbital fissure. Supraorbital fissure, the nerve is passing through which compartment? Supralateral compartment. Is that clear? So now, see the diagram. This is very important point. This is the takeaway point. So in the exams, yes, in the INCT exam, you may get this question. Now I told you the superior oblique muscle. I told you the superior oblique muscle. So the superior oblique muscle, it is a main muscle for intorsion. All the superior muscles, they do intorsion. Intorsion is done by superior oblique and superior rectus muscle. I told mnemonic, since is the mnemonic. That means all the superior muscles, they do intorsion. Superior oblique, intorsion muscle. And it also do depression of the eyeball. Okay, right. Now in the case of trochlear nerve injury, patient is having trochlear nerve injury. Fine. The intorsion is not possible. So patient is having extorsion due to the unopposed action of the inferior rectus and the inferior oblique muscle. The patient is having extorsion. So now we want to correct this extorsion. Now see the patient. The affected eye is this side only. Patient is having extorsion. So if you want to correct the extorsion, then the patient has to tilt the head towards which side? On the opposite side. So patient is tilting the head on the opposite side to compensate the extorsion. So in the case of trochlear nerve palsy, where will be the head tilt? The head tilt will be on the same side or opposite side? Opposite side. So in the case of trochlear nerve palsy, the patient have head tilt on the opposite side. On the opposite side. Okay. Is it clear? Any doubt? No doubt. These are the features about the trochlear nerve course, action of the muscles, superior oblique muscle, and the features of trochlear nerve palsy. Okay, that's all about the trochlear nerve. Now next we're going to see abducent nerve. Okay. Now, abducent nerve again have only one functional column only, general, somatic, efferent, and supplying only one muscle. Which muscle? Lateral rectus muscle. Lateral rectus muscle. Okay. Now, what are the features, the specific features of the abducent nerve? See, abducent nerve, it is the nerve having the course inside the dura mater. It is passing inside one canal, Durilo's canal. So this nerve is having longest intradural course. This nerve is having longest intradural course. Number one. And it is the most common nerve to get affected in the raised intracranial pressure. To get affected in the raised intracranial pressure. Okay. Right. Now, these are the features of the sixth nerve. Fine. Now, where you see the abducent nerve nucleus, it is not in the midbrain. I told you already in the brain topic. Okay. Now, abducent nucleus, it is present in the facial colliculus. Where you see facial colliculus? In the upper pons or lower pons? In the lower pons. Okay. So, sixth nerve nucleus, okay, it is present inside the facial colliculus in the lower pons. That is, it is present inside the facial colliculus. I hope you remember. Inside the facial colliculus. Okay. Yes, see the diagram? This is sixth nerve nucleus. There is a sixth nerve nucleus. Okay. Right. Now, yes. Then the nerve emerge between ponto-pyramidal junction. So the nerve emerge between the junction of pons and medulla, strictly speaking, at the junction of pons and pyramid. Emerge at, not between, emerge at ponto-pyramidal junction. Ponto-pyramidal junction. Pyramid, it is a part of medulla. I hope you remember. Yes. And then the nerve is passing inside one canal. Which canal? Dorilo's canal. After coming out, after emerging at the ponto-pyramidal junction, the abducent nerve, it is passing inside the Dorilo's canal. So what is the content of Dorilo's canal? What is structure passing the Dorilo's canal? Sixth nerve passing inside the Dorilo's canal. So we have petrosphenoidal ligament. Now this canal is formed by petrosphenoidal ligament. The nerve passing inside the Dorilo's canal. Okay. After that, the nerve is passing through the cavernous sinus. See here, this is a cavernous sinus. To the cavernous sinus, yes, we are seeing the internal carotid artery, and below and laterally, infralaterally, yes, abducent nerve. So abducent nerve, it is passing through the cavernous sinus, not in the lateral wall, passing through the cavernous sinus. Two structures passes through cavernous sinus. One is artery, internal carotid artery, another one abducent nerve. Clear? So now the abducent nerve passes through cavernous sinus. Okay. And then which enter the orbit. From the cavernous sinus, it enters the orbit via superior orbital fissure. By passing through, yes, this is the superior orbital fissure, and this is the common tendinous ring. Now, who is passing through common tendinous ring? I told you, Sonia, S-O-N-I-A. S-O-N-I-A. Okay, so the abducent nerve, which passes through our common tendinous ring. Okay, so after passing in the Dorilo's canal, the nerve passes through cavernous sinus. Passes through cavernous sinus and then enter the orbit via superior orbital fissure. Now in the superior orbital fissure, the abducent nerve passes through common tendinous ring and then supply only one muscle. Which muscle? Lateral rectus muscle. Okay, the only muscle supplied by our sixth nerve, lateral rectus muscle. So now in the case of sixth nerve injury, the patient is not able to have lateral gaze. So abducent nerve palsy, the patient is having, yes, lateral gaze palsy. Okay, right. So these are the points you have to know about the sixth nerve. And yes, by this we are completing The third nerve, fourth nerve, and sixth nerve. Very small topic. Okay, but in the INCT exam, they're getting questions about the third nerve injury, fourth nerve injury, and sixth nerve injury. Okay, right. So that's all about this topic.